Hello, everyone. Is everybody connected? Yeah, we see 9 people here. Uh, Welcome. Can you say hi and where you're coming from? Here in the chat. Let me write hello as well. Hello. Let's wait a few minutes and we start. We already 11 people. Okay. Can you write down who you are and where you're coming from? Yes, so today we're going to talk about what it takes actually to become a digital therapeutic expert. It's a bit of our experience shared, mine, also of our guest, Sid, which will join me in a few minutes. So this is what we're going to talk today. So about a bit about digital therapeutics and a bit about what it takes to become one. We have some surprises for you as well that you can take home later on today. So happy to have you here with us. I think we should, we wait a few minutes and then few seconds and then we start. Let's see. Anybody can type something in chat so it's easier to say hello or everything. So I see you are here as well. Oh, Andreas. Hi, Andreas. Good afternoon. Thank you for the invitation. I'm Andreas, a public health physician, actually living around Barcelona. Hi, Andres. Janane, connecting from India. Hi, Janane. Surgeon from Mexico. Hi, Carlos. And hello. Hi, Pedro. Nice to have you here as well. And yeah, I think in about a minute, I think we can start. So a few seconds. So yeah, let me share the screen. So I think we can do this. Let's see. I'm sharing now. Armando, can you share? Can you check whether we are, if we can share already? There we go. Here we are. So once again, thanks for being here. Today we talk about what it takes to become a digital therapeutic expert. First of all, some delays. Yeah. First of all, I would like to thank you and tell you that we are the Future Health Club. So it's an association that we created a couple of years ago with the intention to bring value and create a core community of creative and individuals crazy for digital health and the future of health. So create a community, and our mission is really to empower, to enabling leaders, to future health leaders, to work and so on. And today, this is the third sessions we do in digital therapeutics. One more academic, the other one with experts from digital startups and hospitals as well. And today we get it from a different angle, and we see it from the professional points of view. So how can we really work in this area? Okay. So Francisco, hi Paco, nice to have you here as well. Jose Luis, hi Jose Luis from Madrid, nice to meet you too. When you come in, please just type your name and where you're from, and let's start. So situation, let's give you a bit of background. Situation, we all know a lot of jobs lost due to COVID. and this digital, let's say this, situation. We have it right now. I'm sorry, people like calling me all the time. Next one, I would say this is the situation. So we are around a kind of critical situation right now. But however, the digital health world, it's improving and in getting investment more and more every day. So you see that from in 2010 and 2020, we got like more than 10 billion investments in all different areas, from ML, some from apps, from digital therapeutic solutions like Omada, you can see down here, from analytics for clinical. Here is an area that is growing more and more, and it's very interesting. And this is also shown here from Rock Health. This is the company that always shows the investments per quarter. So we got like the first quarter 2021. And you could see really that in the first quarter of 2021, we are almost at the same pace of the entire year of 2019. So we are really projecting an investments of possibly not doubling the one of last year, but almost. So it's a great area to work in and to be in. And so this is, again, a time to unlock your potential and grow your career. But who is this area for? Who is this basically webinar for? For all of these professionals, like digital health professional, surgeons, we have it here, Carlos, and enable people from regulatory affairs, from the clinical side of it, but also from health tech people, professionals, from people working in technology and so on, tech designers, engineers, but also people from digital transformation professionals, innovation entrepreneurs, insurance professionals, and market access units, for example. This was just 3 groups that we understood and we saw that they could work in digital health. And this is very different from before, because before we were concentrating only in health or tech or business. And this is, as we can see here, is a melting pot of all the 3. So where we have in tech, in health, in business. So now this first question for you, where actually do you see yourself? In which area do you work? In health, in tech, in business, in all of the 3? Please comment here if you like. Hi, Donald. Nice to have you here as well. Please comment. Feel free to comment. Take your time and write it down. In my case, I actually studied business, my background, but I then twisted into digital health from the earlier on. And you could actually see that I got some expertise in each of the areas. I'm not an expert in none of them, but still. Oh, Carlos says thanks. Says all of the areas, so which is good. I think it's having the expertise in all of them. It's a great thing. And Janine say health, great. Thank you. Francisco say health and business. Yes, that's great. Don't say I see myself in between business and tech. I'm product manager in EdTech, planning to move into health tech, digital therapeutics. Great. So this is, I guess, this webinar is for you. Andres says health mostly. And Pedro say, I'm living intersectional of hybrid profiles. True. Let's go ahead and see. Angela says, Angela from Barcelona. Hey, Angela. Business and health from my side, from my part. So let me go back. Let me just give a quick explanation of these 3 areas, which is this one which has all of the 3 included. So digital health, which is the intersection of health and tech, and includes solutions from electronic health records to telemedicines, and to solutions that are apps, for example, or analytics, wearables, and so forth. While digital medicines are solutions that are mainly tools that are clinically clinical evidence. For example, the stethoscope, the digital stethoscope, is one of them. So it's a stethoscope that works like the other one, but it gets all the results on a cloud. And this is great, and is proven to work compared to the regular stethoscope. And then let's go ahead and then say digital therapeutics is what we are talking today. So it's basically an evidence-based solution software that works with the ability to manage, to treat the possible diseases. And this is clinically validated. So we do clinical studies there, but also we take into consideration real world outcomes. So this is it. All right. So yeah, let's go ahead. And so if you are here, then is because you want to boost your career and one of these hot topics, or you have a project and you want to learn more how to make it better and bring it to the next level, or you simply see a big potential as what is his name, Donald, I guess, that he wants to move into digital therapeutics. This is a big opportunity. So there you go. We're all here, and I'm sure you learned a lot about your books and articles, reports about digital health and digital therapeutics. You've searched on the internet, and what else? Here you've been, of course, participating in webinars like ours. We already run 2 more, and conferences that are now dedicated conferences, and not much more, I guess, so far. And if I can go ahead. But I guess it's also in my case, which I work for my own startup, which wasn't successful. So we closed it down and we were building a digital therapeutics. But myself, I didn't know many of the steps, so we failed. So it's not easy to learn and become an expert on this, building digital health solution. And if we go further in digital health, in digital therapeutics, so evidence-based digital health solutions, it's not easy to do it on your own unless you actually make a lot of mistakes and you are happy with that. So again, you need more resources and to reskill for this digital transformation. You are not skilled enough in all of the 3. As we see, only Carlos says all of them, but some of you are experiencing 1 or 2 areas, but not 3, which is tech, health, and business, which is, as we see, important to develop it. And then, or you don't have the network to do that. So are you also feeling in these situations like it was myself, in my case, in the last few years? Please let me know if you do. Don't be shy. Please type. Yeah, Joan says, hi guys, happy to attend. Thanks. Hi, Joan. Nice to have you here as well. And yeah, in my case, actually, we built like or we are on the way to build a digital therapeutics called Mejo Diabetes for diabetes people. And then actually it didn't work out for several reasons. And we will go through that in a bit with our guest. And yeah, and say, yeah, health tech, and say step 1 complete. Donald says, yes, my plan was to become a product manager and then move into health tech. Okay, that's cool. So let's go ahead. And yeah, so everything is possible now with the revolution. Many people are working on it, and there's increasing demand of this type of profiles. So let's say that earlier on, there were actually positions that were hybrid, and then they start working on digital therapeutics and they became expert on it as on the way, like myself, which we failed once, and then on the second one, actually here in a pharmaceutical company where I work, I'm developing a digital therapeutics, and we covered some mistakes. We didn't do the mistakes that I did before, but still, let's go. So yeah, and Jose Luis says, I'm the best director of a digital health accelerator and want to learn more about analyzing this kind of DTX project. That's cool. Here we go. And then, okay, so now let's go to the real, part, the heavy part here. So today we talk about 2 points, which one is the validator potential with our DTX index. So we created DTX index to really see where you stand in terms of knowledge, in terms of attitudes and skills. So, and the good news is that we will actually give it to you at the end of this session. So we will send you an email with the link so you can do it by yourself. Secondly, we're going to explain the SIS building blocks model. So we have created a SIS building blocks. We work with some experts in the field, and we created a 6 building blocks model. And actually, after you see where you stand, we can actually see where you fit the best, because some areas are more techy, some areas are more business related, some areas are more in the health part. So you can actually fit yourself. And last is more, underlining all of this and convince yourself that you too can learn how to succeed in your job in digital health and building digital health solutions, or analyzing, how, like Jose Luis says. So hi, Merce from Barcelona too. I'm in Health and Business Corner and how to design digital health solutions. Nice to have you here, Merce. And at the end, let me ask you for a permission, because we want to explain and share with you what we have created here at Future Health Club. So let us stay, please, until the end. And yeah, again, so what do you think are the most important skills you should have to work in digital therapeutics? Merce, please, go ahead. Or Jose Luis, Donald, or Paco, Andres, Pedro, Angela. What do you think are the most important skills you should have to work in digital therapeutics? Let's see if somebody replies. From myself, if they would have asked me these questions some time ago, I would say tech. You need to be an expert in technology. But yeah, it actually wasn't. It wasn't only that. Empathy, definitely. Anybody else wants to give a shot? No. So then let's go ahead. So we're going to talk about the DTX potential index. And Angela says patient-oriented strategic thinking, innovation skill, absolutely. Being creative, totally. All of them are part of it. Open mind, yes. Understand the health problem to solve, correct. There we go. Great. So we try to summarize all of this and try to put into hard skills and soft skills. So yeah, and Janan says research to create credible evidence, business orientation, absolutely, that is here. So we created, as we said, 2 parts. One is hard skills and the other one is soft skills. The hard skills, as we said, is intersection between health, tech, and business. So unless you have knowledge in health, you won't be able to build anything that is, working in a therapeutical areas like diabetes. Unless you're an expert in diabetes, hard to build something out of it. If you're not an expert in tech, it's hard to get, hard to get the software out in the market, which has a very beautiful UX or user experience and so on. And last is the business. So unless you are able to put these products in the market, it's hard to actually be successful. That was also our case in Merco Diabetes time ago. So and yeah, business, we are used in health to work in business and say, okay, we produce a drug with all the clinical validation and clinical evidence, and we know how to put in the market. But these ones are softwares, and this is a different thing. And we are not like selling, other apps in the market. It's not Tinder, this one, so it's not as easy to find a business model here. And what about reimbursement? So yeah, this is all of the part there. Regarding the soft skills, on the right hand side, we see, for me, very important is the agile methodology. So we need to work in an agile way to be able to get this work done. So agile meaning the ability to work in streams, so in groups, that they solve problems in a weekly basis. So they have like goals in a weekly basis, and then they can iterate all the times. Entrepreneurial mindset, again, this is going to be a trial and error type of work. It's like having a startup. Even if you work in a pharmaceutical company, like my case, you need to change the mindset and be able to see that all the, you're never lost. It's full of a lot of work. You never stop. And on the other hand, it's a lot of mistakes, and you need to get over them and quickly. Better to fail fast, as the Facebook founder said, right? And then the last is continuous learning. This is a new area, completely new area, and new things are coming out. New legislation, the legislation changes continuously, and we all need all the times to accelerate. So this is basically how we base our personal potential index in DTX. And here are like some of the parts that we have created. So affinity to digital health, to healthcare, as we said, to business, to tech. So again, this is the art part. And leadership, teamwork, resilience, absolutely, Carlo. This is part of the, I would say, the entrepreneurial mindset, if you allow me. And continuous learning, multitasking, get out of your comfort zone, again, is part of it. Have you previously failed? This is kind of our case, and we wanted to put it because, as the American always says, that you need to fail a lot to then be able to win and to succeed. And I think this is also, again, the area, and having agile experience. So yeah, this is again an example that we built up. So affinity digital health is my case. Healthcare education, this is not for maybe I get it two. This is just an example. Business education, again, is two. Maybe I have three. Tech expertise maybe is a bit more now that I've worked on with tech people. And yeah, so this is how we think. Let's say people need to rate themselves. And yeah, so we prepare all of this and for you. So at the end of this session, we send it to you so you can play and then let us know, sending us a message, an email, or anything to let us know where is your level and degree. And then here again, I would like to know what all of this is the most important for you. What factors for you? You say Carlos says leadership, teamwork, resilience, so entrepreneurial mindset. For me, actually, it's a mixture of it. It's a melting pot. You cannot have it only once. I mean, you need to know a bit of tech, a bit of health, a bit of business, having all this mindset, working in agile, using agile methodologies. All of this is a melting pot of skills that you need to have. So yeah, and now, yeah, all of this. Again, if you want to reply, you're free to do so. Anybody wants to comment what do you think is the most important for them? The factors that are the most important? Right. Okay, nothing. So let's go ahead. I think we go now to again, another very important topic. Francisco says teamwork. Again, very good, very good. This is absolutely true, especially when you need to work in cross functionals. For example, a person in tech needs to speak with somebody in the health department, or he needs to talk to pharmacovigilance, how the process of pharmacovigilance it's recorded, or how to request for the CE mark, for example. And unless you are able to work in teamwork, it's very complex to do so. And yeah, so now let's go to the next steps. So it's the second part of today, which is our 6 building blocks model, which is the steps that you need to build a digital therapeutics. And what we want to do is what it is. And second is to see where you fit best. So learning on where your expertise is, we can then see and decide, and you say by yourself, of course, where you fit best. Okay. But now let me introduce you to our guest today that will help us to go through the 6 building blocks, which is Sid. Armando, can you open it? Can you let Sid in, please?
Hey.
So, there we go. Let's see if we have him with us. Can we also see him?
Hey, Luca, how are you?
Great. Thanks to being here. So Sid is actually Dr. Sid. Sorry for not letting you know. So basically, Sid is the vice president of Wealthy Therapeutics. Is a digital therapeutics startups working in many digital therapeutics areas so far, in diabetes, hypertension, asthma, I think. And he worked for many companies already with partners like such as Abbott, Roche, Bayer, Ferrer, Merck, Aviva. Uh, so I'm really happy to have you here. And
So good to
please,
be
I would like
here.
you to explain a bit to us what's your background and your experience in Wealthy, also a bit of what you do at Wealthy,
Yep,
please.
yep. I'm
And
so happy to be here, Luca. Thank you so much for this opportunity. And I'm so happy to see clinicians in the group, doctors, clinicians. I'm happy to see that more and more people are switching from traditional healthcare and are seeing the value of digital health. Me personally, I am a doctor, a medical doctor by profession, but since about last 10 years, I have moved into the health technology space. I started off my journey with a proper medical education, and then I moved to US to do my master's. And during my master's, I realized that health tech is the most upcoming field, and I need to do a lot more there. Uh, I I'll be honest with you. My original idea was how to make doctors' life easier, because I saw a lot of pain that the doctors go through because of the EMRs and the EHRs that they have implemented and forced on the doctors in the US. So my initial idea of health technology started off working with electronic medical records and electronic health records in the US. When I moved to India, then I realized that here electronic medical records is still about 5 to 10 years away. But the main thing that is booming here was digital health and digital therapeutics. And that's why I slowly transitioned into this space. I wish I had this kind of a platform where I could learn a little more before I could make some mistakes. But throughout my career of about 10 years, I have been able to work on digital health and digital technologies uh, for various aspects and with multiple stakeholders. And then my current job, where I am working at, is Wealthy Therapeutics, is predominantly facing the patients as the stakeholders. Now, in my because of my past experience, I have worked with doctors, I've worked with patients, I've worked with pharmas, I've worked with insurance, and I have realized that everyone wants something different. Everyone wants what they want. So one of the building blocks that when Luca will get into, we will talk about that. But in Wealthy itself, right now, me and my team have worked and built close to 5 programs that are in digital therapeutic space, and that already have patients. And we have had varied amount of success for each program and each therapeutics that we build, and that is because of multiple factors. And through this program, I mean, with the Future Club, what we intend to do is sort of give what mistakes we have made, and hopefully you guys will learn from the mistakes we have made, and so that you don't have to make those mistakes, and probably you will build better digital therapeutics than where we sort of struggled in a shorter period of time. And that's the main goal here, to turn around these programs faster and make it as user friendly as possible. So yeah, I am so happy to be here, and so good to see health tech and people from the health background looking at digital therapeutics seriously and digital health as the next opportunity.
cool. Thank you, Sid. Let's go into it.
Yeah.
And let's see, go one by one. Maybe Armando, you want to put again the the presentation and the building blocks. So here is what we managed to work with Wealthy and other partners to actually design these building blocks. Can you already see them? I have a bit of problem with my phone.
I can see them. Look.
You can see them? Cool. So let's start from,
I
I
can
guess,
see
from the
them.
beginning. If you
Yeah.
want to actually go through them, see it
Yeah.
one by one, I think let me just do the first one, and then the rest is for you.
Sure.
So the first one is basically, as we said before, we need to make sure to understand in which area we're playing in. Like what is the ecosystem nowadays? I mean, Spain is a very different ecosystem from the one in the US. So what are the trends? Mental health is one big trend, for example. Chronic diseases is the one that many companies worked in, and Wealthy is one of them. So this is part of the ecosystem, understanding the ecosystem, understanding that you need to work in a methodology, and you need to imply talent to work on it. So knowing all of this, you're already able to start with the second point, which is value proposition. Yeah. Go ahead.
So what I want you guys to know that it's not one after the others, right? So this is not sequence. I have personally, I have expertise, and I came with background in the number three. But over my years of experience, I've realized that everything is so interconnected that you cannot really just choose to be an expert in one and not have knowledge, or at least the know-how for others. And I'll explain a little bit. And like Lucas said, the ecosystem and trends is what got me here, right? The methodology of Agile is a technology based methodology that is applied everywhere. Knowledge of that and knowing is very important just to get started. The second one, if I'm to call it, like, it's not chronological, but second one in this context is the intended use and human centric design. I think one of the respondents mentioned about human centric design, and I mean this is absolutely a given fact, right? Like, who are we designing it for is absolutely essential. And throughout this journey, when you're talking to the stakeholders, when you're talking to your patients, your doctors, your clients, you have to constantly ask them why. And why will give you the answers of intended use. If the why is not as clear or is not coming out clearly, then you haven't done your job yet. So throughout these blocks, keep asking yourself why, and this will sort of help. Human centric design goes without saying why. You have to design it for the user, but these humans are different. A diabetes patient is completely different from a patient suffering from dyslipidemia or suffering from a rare condition that he or she doesn't know much about. So the human centric design, not only in terms of user experience or user interface, also about the humans that have these conditions and are suffering from it years on years. The third one is customer excellence and product architecture and design. This is specifically where me and my team focus a lot of our efforts on. This is basically taking into consideration as many experiences, as many conversations as you can with the customer. And your customer is going to be very different. Like I said, I have worked with patients, I have worked with doctors, I have worked with pharma companies, and each of them have their own needs, and they have to somehow come together for this product to work. Also, it's essential to understand who is paying for it, like, which is block number 6, but I'm just connecting the blocks here, because just to know that depending on who is paying for it, your architecture, your product, and your product design completely changes. So the point number B, 3B, which is product architecture and design, is not entirely dependent on just one customer or one stakeholder. It completely depends on on all the stakeholders involved, so that the design is such that the buyer, the seller, and the user are all interconnected. The most important part for in the Indian environment here is the doctors. When we talked about a European environment or a US environment, the center is more of the payer, like who's paying for it, is it reimbursed? So all that needs to be taken into consideration when you are creating the product. Also the length of the product. So when you're creating any digital therapeutics, you have to make a decision of how long will this product be used by the customer. Is it going to be a short term, which is going to be about 12 weeks, 16 weeks, 10 weeks, 6 weeks, or it's in years, which is 6 years, 1 year, 2 year. So all those elements make into or go into designing a product and designing the architecture of how the product is. There are multiple parts in the product that I won't get into in terms of details, but those we talk about in the blogs. The fourth one is data and technology. I think this goes without saying. We are in digital therapeutics. Data is the key. Data is gold right now. Any sort of clinical data that you have, uh, there are multiple stakeholders that are just looking for this data, and essentially the patients. There is a lot to do with improvement in clinical outcomes that can be done with this data. There is the real world evidence that we need to get from this data. There is clinical studies or decentralized clinical trials that can be done using this data. This technology is also used for, like I said, decentralized clinical trials. They can be used for reimbursement claims. They can be used for pharma companies to get into real world evidence claims. So this data is absolutely gold, and depending on your stakeholders, uh, the data needs to be modified as to what we capture. I'll correct myself, not modified. Data sets or data points need to be defined as to what we capture and what we store and how we store it. The technology also has to be taken into consideration as to how global they are. What are the global standards of privacy, of storage, of interoperability, or even sharing data? And that sort of takes me into the number five, which is regulatory and clinical validation and health economic outcomes research. Now, the transition, if you see, the technology and regulatory is sort of hand in hand. You, depending on which environment you're working in, maybe Europe or maybe US or maybe Middle East, depending on that, your regulatory environment changes. And that's the reason you have to know this. As a clinician myself, I was not completely aware of this at the get-go, but over the past 4 years, I have sort of learned more about it, and now my decision making about the product is sort of driven or is augmented with the know-how of regulatory. For example, the FDA has regulations that are completely different. GDPR regulations are completely different, and they are asking for things that have to be done in a different manner. PDPA, if you're going towards the Southeast Asia, PDPA is another set of regulations that you have to comply with. Your product needs to comply with, your data storage needs to comply with, your technology needs to comply with. These are just a few that I mentioned based on the geographies that we want to get into or what you want to get into. I saw somebody is from Mexico. I'm not completely aware of about Mexico, but each of geographies, each countries have their own regulations, and those are absolutely critical. Obviously, there are consultants that you can work with, but the consultants won't help you with the product. They will give you an overall view of the regulations about what is good, what is bad, what needs to be done, what is missing. But overall, the product needs to be ready, and you, as a product owner or a product manager, or building this digital therapeutic, needs to know as much as possible about these regulatory aspects. And the last one, I think this is the one that I have struggled with the most personally, because I come from a clinical background. I have sort of learned myself or taught myself what is technology, what is coding. I've started coding, but business is the most important one, if I may put it that way. And I have struggled with it the most because of my background. But business modeling, go to market, product life cycle, and user excellence is something that all product owners or anyone that gets into digital therapeutics needs to know. I'll give you an example. Business modeling, or who we are trying to get to, completely changes the product right from the onboarding. So I'll take a live example of an application that I have worked with in the past. From right from the time the patient downloads the application till the patient reaches the home screen is entirely dependent on business models. And I'll give you a few examples. An insurance company would, or an insurer would want as less fields, sorry, as more fields to be captured as possible, because they want to do a health risk scoring based on that. Some of the insurers that we have worked with, a pharma company, a pharmaceutical company, would have the least resistance possible, so that the patient reaches the home screen as fast as possible and starts using the product. As a consumer, if it's a patient facing a B2C app, the onboarding needs to be the fastest and the least resistance as possible, so that the patient or the user has no difficulties getting into it. Now, any sort of changes that you see in the onboarding process needs to take into account where are they coming from. If it's a B2C market, we need to be as user friendly as possible. Maybe have Google login, maybe have Facebook login, things like that. But again, if it's from a doctor side or a clinical side or a pharma side, we need to have proper OTPs, like a one-time password, or authentications involved in that, so that the process is smoother and complies to regulation. Also, like one of the parts, again, going back to the regulatory affairs, when you're working with pharmas, the regulations are much different. When you're working with a B2C client, the regulations are a little different. So all these factors sort of come into picture and play when you're building the product, right from how they download, how they use, what data they enter, and what sort of outcomes we want to achieve from that. Yeah, I think I'll take a minute here. I think, Luca, you
Oh
want to
yeah,
pitch
I
in?
mean, first of all, thanks a lot. I think it was very, very insightful. And maybe I want just to add that in the last part of the point 6, it is always very important, and I've learned it from past experiences, that the 6C, meaning that whatever we learn from the data that we gained before during the usage of the app and the solution and so on, that drives a continuous improvement of the product. That's really differs from the development of a drug, which stays the same, possibly for maybe it changes the packaging, maybe, or how the way the posology of the drug, but still remain the same. Well, here it could actually change quite consistently if we, if the users needs it or requires this, right, from the users. So this is actually an interesting part. Now, I don't want to be very tedious, so I go quickly, and we wrote here like some of the mistakes that we all did, or at least myself and Sid. We collected some mistakes that are typical for each block if you want to build a digital therapeutics. So in my case was believe that you already know what your market wants, and that is the case without asking actually the user what he needs, right? What's the real problem, and what the needs behind it, right? So this was one of my mistakes. For you, Sid, what was one of them?
I I think rather than underestimating a stakeholder, a lot of times the stakeholders will misguide you. And this is we have so when we do the patient interviews for before building a product, the patients will say yes to everything. Some of the patients. So you have to be very careful in understanding what they actually want, and that completely depends on how you ask these questions. We have gone into the market and said, hey, will you use this product? And everyone said yes, yes, absolutely. And when we actually built the product, nobody wanted to use it. So this is a difficult one to solve for, but not asking is not an option. It's about asking the right questions to the right stakeholders. The users need to be asked, how will you use it rather than will you use it? And the payers will be asked for how much will you pay for it rather than will you pay for it or not.
Cool. Let's go to the next one. Value proposition. So the three typical mistakes: identify problems and not needs. And some many people have problems, but they actually, when it comes to, they don't see it as a need, to improve it. So this is one of the mistakes that we made ourselves, at least. Not having a value proposition for each stakeholder. That is exactly what you explained before. For whether rather is a is a patient in our case, or is a doctor, or is a payer. So we need to consider all of the three. So when we do the research, needs to be included the three research in the three areas, and then being able to actually gather all the information and having a clear intended use. This is also important. And we want to solve too many problems. This is impossible. We need to find one problem only and try to solve it. Then block 3. This is more of yours. Sid, go ahead.
So delightful experience. I like the word delightful for a chronic patient, but the experience, like I said, needs to be catered to or modified according to the patient population that we work with. I saw earlier that there was a surgeon in the group. Surgical patients or post-surgical management through digital therapeutics is completely different compared to a chronic patient that we manage, right? So understanding these needs and then building experiences for them will solve a lot of, will save a lot of effort in sort of building or then remodifying it later. But there is no single experience that fits all. It's not possible. Each digital therapeutic will have to go through its own cycle to reach here, and the experience for each of them have to be different. If you try to solve many problems, you may not be able to solve any of them. So pinpoint those main prioritization or prioritized points, and then try to resolve them one by one. The beauty of digital therapeutics is that it can evolve over time. So even at the outset, if you want to take one problem to solve and one experience to improve, overall, every month on month, you can add features, you can keep working on the previous experience that you had built, and overall have a better product design. But if you do not have a basic first level, you will lose the heart to go further, and the patients will never use it. So try and start off with like first one, and then have a clear product design idea that, okay, I want to get here, but I want to start at this point, and then sort of build on, a month on month. And that's the approach that we have taken usually.
I mean, this lean methodology, let's say, I think it's using the lean methodology. Let's go to the, very lean product and then add it on top of it, right? So then it's building blocks, robust products. So thinking that technology is the most important. This is Armando, my colleague, that put it, because it's suffered a lot with technology, but technology actually is very important. It's one of the key barrier here. I mean, we need to make sure that we have on board. Here, I think it's one of the most difficult part, because who speaks about products don't speak the same language as the engineers, right? So I think here is one of the area where it's actually need a lot of teamwork, like Paco said before, right? So what do you want to add, Sid? You have more experience than I do, I guess.
So I like the point of quantity over quality over quantity.
Yes.
Uh, Actually, I would put it as quality over quantity. The reason being, if you try to capture a lot of data at the outset, it's then later on gets very difficult to make sense of this data. So I would say prioritize your data points first, have them in place, understand why you're capturing certain data points and who will they most relate to, and then sort of build more and more data points as we go ahead. And that's about building a better product in terms of data.
Cool. Now, last two, I think it's in terms of value and compliance, let's say. So not hiring the best partners to manage the regulatory part of the products. And I think it's, as you said before, the partner, even if it's a consulting company expert in digital therapeutics, as they're now growing more and more. So
Yeah.
building software as
So
medical advice. Still, I guess here it's more about how you then integrate all of these part within, right?
Yep. And there is a question from Jose
Yes, please go ahead.
on regulations. So I'll take that at this point. Regulations are depending on multiple aspects. So um, there are technology based regulations that are put by ISO, in terms of standards to follow. There are clinical regulations that are in terms of guidelines to follow. That guidelines also differ from population to population, region to region. For example, an ADA guideline, which is American Diabetes Association guidelines, will be a little different from the European Association guidelines. Similarly, the cardiac associations will have separate sets of guidelines for their own population. And it makes sense because the populations are very different. The Asian population responds very differently to medications compared to the American population or the European population. And hence, these guidelines are set by local authorities, local bodies that put the patient in the center. And depending on where you're working with and who you're working with, these guidelines and regulations sort of change. Also, like pharmaceutical companies have to follow certain regulations because they are the drug manufacturers. So there are certain regulations. For example, you cannot market your drug or you cannot push your drug through these digital therapeutics. That's a point that we understood while working with this. But for an insurer, you don't really care. Everyone that comes in through the insurer sort of can be covered. You can talk about plans, you can talk about premiums, you can talk about future buying those premiums every year on year. So the regulatory environment is very different for depending on which stakeholder you're working on, which geography or country you're working on, and also if you're working from a B2C perspective or a B2B perspective. So I hope I have answered that specific point. But yeah, hence the number 5 is absolutely important.
I think the number 5 is the one that separates from building digital health products to actually building digital medicine and therapeutics, not the evidence-based part, right?
Yeah.
Yeah. So, and then the last, it's not understanding the reimbursement pathways. So let's see. This digital therapeutics can be B2C products. This is mainly how they start when companies build these solutions. Not the case of Wealthy, because Wealthy produce for pharma basically and for insurance for others. But when you are a startup and you build digital therapeutics, for example, for pain, like Kaya Health does, first of all, you start producing these solutions for a B2C to test the market basically when the market is really receptive, and then you do more clinical trials and you reach for payers, for insurers, especially in the US. And yeah, Um, Perfect. So this is, I think we want to close here. I'd like with you, Armando, can you take off the presentation? I know we still have one thing for before. So it's which block is more suitable for your knowledge and characteristics? I see that for seed is clearly the number 3. For me, mostly the number 1 and 6, I would say. What about you? People at home? Pedro, Jose Luis, Carlos, Merced. Give us a shot if you like. In the meantime, I think Sid, just not to go much over time, would you give a last hint on this field and yeah, the last week for
Wow.
you.
I think throughout this, I've put a lot of hints rather than giving. But I think if I were to sort of close, I would say that when you're building any digital therapeutics, doesn't matter where you are and who you come, like what sort of background you come in with. Uh, the the environment is so fluid that you can never be satisfied with, okay, I know everything. So it's a constant uh, upskilling yourself that is required, even though this platform is absolutely essential and would have helped me about 4 or 5 years ago when I first entered this market. But it's a constant need to upskill yourself in that particular area. And the regulations are so fluid and so changing so fast, that you have to be on your toes and understand where the opportunities are, and what sort of areas that you have to learn more about, and what sort of areas are the upcoming ones. So I think, if I were to think that I am an expert now, I'd be a fool, because I would have to constantly learn more, upskill more, understand new technologies. Because the thing with technology is it gets obsolete like faster than anything else. So I think that would be my closing comment. Upskill yourself constantly once you get into this field.
Perfect. Thanks, Sid. Really, thanks very, very much. And we speak tomorrow because we collaborate in a project, and I speak more with him than with my brother. So uh, that's it. Let's go for the last part of it. Just bear with me a few more minutes. And yeah, Jose Luis says point 1, 2, and 6. Interesting. Pedro says 6 possibly. Well, all counts. Francisco says 2 and 3. I couldn't have any doubt about it. And yeah, Vera 2 and 2. But let me go close up. So we prepared today this close your potential. Validate your potential with the index. We will send it later on. So to check your potential, to see what your role is, and then how you actually make it in practice with the roadmap, which give in a second. So if you're still here, and I see the majority of people are still here, which I'm very happy about, is that you want to achieve your potential, you want to grow in the digital therapeutics aspects. Getting where seed is, it's very complicated, but it's part of experience, and it can be speed up from it. And then my question is, can you imagine becoming an expert in DTX? Feel free to answer if you like. And now the last part, I would like to introduce you to what we have worked for the last months, seeing the failure we had in Mejo Diabetes, and in my experience, the late experience in building another digital therapeutics, possibly this one much more successful with Ferrer, my current company. So Pedro say, why not? Of course, I hit this mistake in missing an E in becoming. But so now we have prepared this, which is we call it DT Excellence, and allowed us a few more minutes to go through this program that we have created. So it's the first actually complete training dedicated to digital therapeutics. If we haven't make any mistakes in the research, there are some part of it are covered, but not totally. And so the 11th of October, we launched this DT Excellence program, which the idea is to give to work on the 6 building blocks models, as we explained before, and to go through with experts, and we will show you who is the part of the faculty. And the idea is that we work each block, 1 block per week, and then we will have some content which are pre-recorded, which are more theory, and you can have it forever. And then every week we have a workshop, basically, that live with all these experts like Sid, and we can ask questions, we can put in practice all of your doubts and so on. Again, we go through each of the 6 building blocks to start with the proposition, and we get expert on each of the areas. So if you want to, get knowledge you need to become an expert, we want to give you all the aspects of digital therapeutics. And last, at the moment, few people only are trained on this. And this becomes from experience because there are no courses so far. And so we collected some of the faculty members. We have a few here. Some of you know Aline is a very top connector worldwide. Mercedes as well, in terms of design thinking and human-centered design. Sid, we speak it. Eugene is the head of G4A, Ground for Apps, is the first open innovation program in digital health built by Bayer, and also is faculty at Harvard. Luis Fernandez Luque, part of the Adira Health, which is a company from San Francisco. Alira Health and Area is Vice President Market Access, so Block 5. Carmen Rios is part of Vice President International for a company that is building digital therapeutics for mental, for adolescents, for mental health. And I love Jonas is one of, we work together. It's a very interesting guy. He leads Kaya Health. Kaya Health is a company which is actually a startup which more than 123 million investments, one of the top in the US, working musculoskeletal problems, so pain problems basically. And he has a solution that is patented and so forth. And he already served more than 450,000 patients, so that's great. And Opino helping us with the agile methodology. So this is the idea, is that we create something for you to save time when you build one or you're one of these projects, costs in terms of don't do things many times and unnecessary mistake like we did, and we try to help you to avoid them. So the idea is that we have already helped and worked, accelerated people from these companies. And now we are really happy to go further and to build this 6 weeks program, which is working basically from Monday to Thursday. Every Monday we open the videos, basically. They open the content. And Thursday we do the workshop, we put into practice. And beside that, we create a private mastermind group, which means that we have a group with all the students that we will have in the program, but also all the experts. So you're free to enter this app that we have and chat and ask all your doubts during the week with all the experts that are belonging to that block. So, and we have 2 extra bonuses. For me, it's very important, as I said, work in agile, and we have these experts from Opino that are able to help us basically to learn how to work in agile. And also, I think it's as important as creating your personal brand and be very clear on what has your potential and your growth, where you need to work around. And we will have also a session for personal growth, which has 2 extra blocks that's on top. And the idea is that we have weekly group sessions, as I said. So basically work on on each block and do workshops and be able to ask all the questions that you need to solve. And what else? Basically, this includes, as we said, the videos of the 6 blocks, 2 extra bonuses, 1 weekly group session. So as we said before, private mastermind group, and the of course, a certificate at the end of the course. We do it through, you can do it via phone because it's an app, a tablet, via computer, and so on. So it's a virtual group program. And yeah, as we are proud of our products, we think that you have the 15 days money back guarantee as usual. And we come to the end. I think now there are 2 more slides to go. And one is you can choose whether you can learn as we did, Sid and myself. So by working on trial error, so make a lot of mistakes and learn from them, or use our methods, which means learning from the experts in these 6 weeks and try to avoid many of the mistakes. It doesn't mean that you will not make mistakes. This is wrong. Otherwise, you won't have this entrepreneurial mindset. But this is at least to avoid some of them. And yeah, this is the most commercial part, let's say. So the course starts on the 11th of October, but we do this pre-launch for you guys for this. We did the pre-launch today, and with the 20% off of the price, which is less than a good conference ticket. So that is it. So you have 48 hours, 2 days to get in contact with us, and yeah, we have a call and we explain you better what's the program is about, if it's good for you. We only want to have 20 people this batch because we want to have the best experience ever. So the idea is that if you want to join and get these 2 scholarships that we put available and the discount for the early bird, let's say, or early decisions, you're free to do so. And here below you can see the link. We will send you also later on via email, together with the index. And I'm now leave my contact details as well. You can write to WhatsApp, and if you have questions and so on. And feel free now to ask questions if you have. I'm here. Otherwise, yes, I won't steal any more time. I'm available now for questions if you have about Digital Therapeutics, about the index, about the program, everything. Sorry, guys, I look on my left-hand side because I have my mobile here with the questions that pop up. So let's see if any question comes up. Otherwise we can close the sessions. Feel free to have questions to send me an email, send me a WhatsApp, or book a call on DT Excellence. And that's it. I think this is all. Thanks a lot for your time. I see many of you are still here, or almost all of you. So I'm very happy to have you here. I hope we brought some help and some ideas, some idea for your future of career in DTX and in digital health in general. And so I hope to see you soon. Thanks a lot for joining. Bye.